And just as an example, what types of things would they actually be doctor shopping for? What is this? What's a symptom that's a real world example?
The ones I usually see the most are memory loss or memory slip-ups, which some people would actually put into the functional neurological disorder spectrum. A lot of chest pain that has had every EKG and medical workup you can imagine, or sensations like ants crawling or physical pain, neuropathic pain, for which it has no explanation. Those are the most common ones, which is...
And let's just take each of those, in as much as you know details. I mean, what would be triggering events? Right. And I'll tell you where I want to kind of go with this, which is I want to understand the genetic factors that would predispose a person to this versus the environmental factors that would predispose an individual to this. I've had a number of folks on this podcast where we've talked at length about the heritability of various psychiatric illnesses. Using concordant and discordant twin studies, we can get a pretty good sense of how these things work.
And we know that with health anxiety, the heritability is about 30 to 40%. It's on the lower side.
So it's low compared to where we see with
schizophrenia,
autism are very high.
On the 70s to 80s sometimes.
Yep. Okay.
Right? So
this,
we're on the low side,
seems,
but it's there. It's there. There's a genetic loading that's there.
Yep. But when you say 30% heritability, I hear environmental triggering.
So do I.
Okay.
So do I. I hear in the diathesis stress model, the diathesis is there, it's low, but it just takes that right context to make it come alive. And for some populations, for some people we work with, a trauma. Trauma can induce this. Trauma can cause all sorts of physical manifestations of discomfort and distress and pain. And whether that's a physical or sexual trauma or an emotional trauma or loss, there's enough research and large-scale studies to demonstrate, even with seizures, PNES, psychogenic non-epileptic seizures, that emotional and physical traumas can demonstrate then bodily reactions that are not explained, which we used to call conversion disorder. So trauma is a notable thing. Family history of it, where parents are complaining and describing similar symptoms. So I see that quite a bit. I see that both with OCD. OCD has a heritability rate of about 50%, 40 to 50%. Mm-hmm. Health anxiety is a little bit lower in both populations.
And what about general anxiety?
So general anxiety, I go by disorder, unfortunately.
Okay.
So if I go by disorder, I can tell you, but in general anxiety, I assume it's probably still in that 30 to 40% range, just in general. I don't know of any other disorder outside of OCD that has a higher heritability rate there's 9 anxiety disorders I usually refer to. That one usually has the highest genetic loading.
And that's the 40 to 50%.
That's the 40 to 50%. So I assume across the board, if we merge them all together,
it's going to be lower than that.
We're going to be in that 30 to 40% range at best. It's very atypical for me to meet a child or teen with OCD and to not have a first-degree relative who has it.